Yes, Mr. Van Dam. It's Dr. Verenz of Preferred Care. I'm calling you today to let you know that the specialists from the United States have already gotten back to us. And they too agree that your particular situation does need to be addressed. However, they recommended repairing the valve rather than replacing it, as was originally discussed with your cardiologist. So, what I'll do now is send your cardiologist a second opinion for you to discuss that matter with him. And again, Mr. Van Dam, I want to reiterate and be certain you do understand that if you do decide to be treated for your heart condition in the United States, we will of course take care of everything for you.
As I was playing tennis with Mark, I suddenly became short of breath, which worried me a bit. So the following day I went to see my specialist and learned that one of my heart valves wasn't functioning properly and that I needed surgery. I then contacted Preferred Care.
Preferred Care, Susan speaking. How can I help you?
Yes, hi. Peter Van Dam speaking. I'm calling because I've just learned that I have some sort of heart condition. And I'm wondering if it's possible that I can get a second opinion. Can you be of any help?
Yes, sure, Mr. Peter Van Dam. We've got your files, and I will contact Dr. DeVrenz informing him of your situation. But in the meantime, he will collect your medical records for the doctor to review, and after the doctor has reviewed your records, he will contact you personally to explain to you the full findings and processes that will be undertaken for you.
Dr. DeVrenz did indeed call me soon after, and I was very pleased with his immediate attention. My medical records were sent to the U.S., and this is also my first conversation with my personal care manager.
My name is Paulette Stark from PGH.
Hello, good morning.
I'm going to be your care manager, and I wondered if I could spend a little time talking with you now.
Yes, of course.
Is English okay to talk?
Yes, that's okay.
As a personal care manager, what I'd like to do is talk a little bit about what the process will be like, get to know you a little bit, and make sure that we're doing what's best for you.
Dr. DeVries, yes, how are you, sir? I looked at the information on Peter Van Dam, and in looking at everything and looking at a CD-ROM, I think you'd be an excellent candidate for a primary mitral valve repair. We would do it through a minimally invasive approach, but I think you would do very well with that.
Okay, well, that would be a perfect opportunity, and I think the best thing would be that I will contact his cardiologist here in Holland and discuss it with the patient himself and his cardiologist, and then get back to you on further proceedings.
I think that he could really get back to a pretty normal lifestyle afterwards.
Of course, Preferred Care allowed Vilma to come along for support, but we decided against it in the end. Soon Butterfin will be back in school.
Good. Hey.
Hi, Peter.
Hi, Peter. It's nice to meet you.
Nice meeting you, Paulette.
How was the trip?
Well, tiring, but it was okay.
Yeah?
Very nice, yes. Very nice.
Well, it's nice to
Yeah,
finally
nice to have a
meet
good
you.
Conversation. Yeah.
The driver should be right out here. We're going to head back to the hotel now and give you a chance to take a little rest. But what I want to do is give you a phone so that you can get in touch with me at any point.
Hello, Paulette.
Hi, Peter. So it looks like you got a chance to change. Did you get some rest?
Yes, and I had a shower. It's a very nice room, I would say.
Good.
Thank you.
As your care manager, I'm going to be spending a lot of time with you, and I'm going to see to it that knowing what it is that you want and need, make sure that the hospital and the doctors know about that. Tomorrow's a very important day. We're going to see Dr. Mudge at 10 o'clock, and it's going to be very important to get all of your questions answered and make sure that you feel comfortable with this treatment plan. So, Peter, it's really important that you be sure you ask anything at all.
Okay.
And I'll help you because we talked about some of the questions.
Yes, please, yes. Okay.
Hi, Dr. Roach. This is Peter Van Dam.
How are you?
Hi, Doctor.
Nice to meet you.
Nice to
Welcome
meet you,
to
sir.
Boston.
Thank you very
How are
much.
you?
Good to see you.
Please come on in. Thank you.
Shortness of breath.
Yeah.
Chance to review those.
I've seen everything.
So you knew about that.
You've basically been in good health all your life. That there is a leak in the mitral valve. And restructure the... This is a picture of your right coronary artery.
One of the things that Peter's been worried about is
I think he will be able to lead a pretty normal lifestyle within a month after the operation.
My name's Nancy, and I'm going to be with you for a little while, get you ready for surgery. And there's a good chance you'll see me after surgery as well.
and you should be recovering within a couple days.
How are you?
Well, kind of anxious.
The incision will be no more than about 4 to 5 centimeters in length. You'll be up walking around within 24 hours after the operation, and hopefully out of the hospital in 3 to 4 days.
Get you settled into your room, your operating room.
Hello? Hey, Eric. Yes, fantastic. It went well. In fact, I'll be in on Monday. Of course, I still have regular checkups, but that's how it goes.